Hey, I was paying off some medical bills. We've got a whole bunch here. And I was doing some research into paying off medical bills, just learning about the process, why it's so complicated. I mean, it was really complicated, paying off like 7 or 8 different medical bills. And I found some very interesting things, some very useful things that I wanted to share in a video. Hopefully you find it useful. I'm going to share the tips first and then I might rant a little bit. But the first tip is, depending on your income level, you are very likely able to receive a discount from that hospital. So you can actually look this up. So this is for PHS, which stands for Pershing Hospital System, which is the main hospital in Brookville, Missouri. You look up financial assistance. You just Google those terms. You do hospital name, and then you add financial assistant after it, and you'll find like a bunch of Google links. The first one is probably the one you're looking for. You might have to click a few other links, but you'll find something that looks like this. I'll try to make it a little easier to read. And this is basically a discount table based on your family size and how much money you make. So if you have a family size of 3, for example, let's say you, your spouse, and you've got a kid, like my family, and you make under, I think that says 49,000, it's backwards for me, so I think it's 49. If you make under that number, you actually get a 60% discount on your medical bill. Like Pershing Hospital System will just say you get a 60% discount. If it was $100, now you only have to pay $600. And so the larger your family size or the less money that your income is, the larger discount you receive. So if it's just you and you earn less than $14,000, you can get your entire medical bill completely forgiven. You just don't have to pay it. And this is because most hospitals are actually nonprofit. Like they're there not really to make money. They're there to help people. And most people don't know about this. In fact, I would say that most people don't know about this and overpay because they don't know about it. So I highly recommend if you fall under any of these income levels, based on your family size, I highly recommend looking this up and looking into actually getting this discount. Almost all, actually I think all hospitals, nonprofit hospitals, which is most of them, have something like this. So that was the first tip. I thought that was really useful. Unfortunately, I guess rather fortunately, it kind of caps out at 100,000 here. If you make more than 100,000, you and your spouse, you actually aren't able to receive any of these. But I thought that it was really helpful, and I thought other people might find it useful as well. So that's tip number 1. Tip number 2 is that among this pile of medical bills I received, some of them were quite vague. Now, unfortunately, I went through and just paid them all because it was just a pile of things to pay, and I went through and paid them all. If you ever get a bill like this, which is clearly from Mosaic, it says total charges $250. Now, I blurred out personal information, but what you can see here is total charges $250. Now, first of all, this doesn't tell you what it's for. It doesn't say, hey, $100 for this medicine, $50 for this specific like hospital waiting room. Like it doesn't actually tell you what it's for. So if you ever get a bill like this and it says total charges $250 or whatever number, and it doesn't actually like lay out what you're paying for, it is very likely that you can send Mosaic a letter and say, hey, you might want to do it a little more professionally, but you could say, hey, itemize these for me. Tell me what this bill is for. And it's very likely, and I say very likely because as I was researching this stuff, it's very common for people to request an itemized list of what their bill is, and then the hospital will come back and say, oops, we made an error. Your bill is only $40. Or oops, that was an error, it's way less. So if you ever get a bill like this and they don't tell you specifically what it's for, it's very likely that this number is way higher than what you actually should be paying. And hospitals do this sometimes because they know they can get away with it. Specifically larger hospitals. Other hospitals do it because it's an error. But if they don't tell you what it's for, request an itemized list and say, hey, why am I getting this bill? Is this $250 because you had to send the previous bill and that was the cost of you to send me a paper bill? Like they can come up with whatever they want here if they don't tell you what it is. Now, if you ask what it is, it's very likely this number will go down. Now, unfortunately, I did pay this bill. I should have argued it. I would have loved to see what this bill is actually for, other than just a bill in the mail that says, hey, pay $250. Now, so those were the 2 tips. Look up financial assistance if you have a hospital bill, specifically for the hospital that you're going to. It's very likely people watching this video will find that useful. The other one is if you ever just get a bill that just says, pay this money, and it doesn't look, I can't share any of these other ones because they have personal information on them. But usually they go through and say, here's the medicine that, like my son got teeth cleaning, and one of them was like the medicine used to like numb his teeth. Another one was like the hours in the actual like dentist office. If they don't like tell you what that is, ask them for that itemized list of what the $250 is, especially if it's a round number. Usually it's not a round number. It's like the medicine was $43.70 and the hours you spent 3/4 of an hour in a waiting room, so it was $140 or something like $142 or something like that. So those were the 2 tips. Now on to venting. So the first thing I want to vent about is paying all these medical bills. There, 1, 2, 3. I guess there's 8 medical bills here. I had to log into separate places each time to pay them. It took me 10 to 20 minutes to pay each bill, which means that's like over an hour to pay all these bills. And each one I have to have a separate account, and I've got to like verify my account and have an email sent. Why can't there just be a single place where we just pay all these medical bills, and then the single place, like why can't insurance be that? You just pay insurance and then insurance pays all of these. It was quite frustrating paying all these bills. 2 of them I can't even pay. 2 of them are sitting in there on the desk right now because one of them only accepts a check. I don't know why you have to send a check when we have like the age of the internet, when you could receive a payment instantly without having to use checks. Half the people I know, most of the people I know don't even use checks anymore. Most adults that are under the age of 30 don't use checks. You have to pay for checks. I don't know why one of them you had to pay with a check. Or I guess the alternative was writing down your credit card number on a piece of paper and sending it through the mail. Like, that's super secure. Probably shouldn't be doing that. The other one, I tried to log in. It had me create an account. After I created an account, it says, yeah, you have an account. If you want to pay your bill, create an account here. And I wasn't able to create an account here. Like, people that know me, I'm not a tech wizard, but I know how to use a computer, and it wasn't letting me set up this second account. First of all, why do I have to create 2 accounts to pay a bill? Second of all, what's the error with this? Like, I've waited a whole week, tried to set up an account on this second website to pay this bill twice. So why does it have to be so complicated to pay bills? All right, that's the first part of the rant I wanted to rant over. The second part is my family is paying so much money for health insurance, it's crazy. So I have this app, I think it's called Sydney Health or something like that. I went through healthcare.gov insurance because I am self-employed, so I technically don't have a job. I don't have a W-2 job. And my wife is going through school right now, so she technically doesn't have a job. And because of that, neither of us are able to get health insurance through our employer. And because of that, we have to go through healthcare.gov to look up through their system and basically buy health insurance from the government. That health insurance from the government is so expensive, and we get such little coverage, it's almost not worth it. And I'll explain with the numbers really quickly. So our monthly premium is $1,600, $1,600 a month. That's almost $20,000 a year. Along with that, I'm still having to pay all these medical bills, which blows my mind. Why? So I'll move on. First of all, 46 claims. We have not went to the hospital that many times. So those are obviously like, here's a claim for the medicine that you received. Here's a claim for the prescription that you had to get. Here's a claim for the amount of hours in the hospital. Here's a claim for that specific doctor that you saw. I don't know why we have to do that. Number 2, why does it say total bill by providers $29,000? First of all, $29,000 is a huge number. If I didn't pay for insurance, that's what I would be paying with my own hard-earned money, $29,000. Secondly, what the heck is this total plan discount for $20,000? I looked it up. Do you know what that means? It means the insurance actually goes to the hospital, goes to the people that are getting like where all these charges are coming from, and they go, hey, instead of charging him $100, can you just charge him $30? And the insurance, those places, they go, yeah, we can do that. That's what this discount is. It's a discount for being on this plan that your insurance provider negotiates those rates. So that means this discount shouldn't even exist. I should have only been charged like $9,000, except I was charged $29,000 if I didn't have insurance, and because I have insurance, I get the $20,700 discount, which is crazy to me. Secondly, how much has the plan actually paid? So it's halfway through. Let's see, 1,600 times 6, probably shouldn't do that in my head. I know 1,600 times 12, which is a year, is around $20,000 a year that I am paying for insurance. So half of that is around $10,000. So I paid around $10,000 to have insurance this year alone. How much has my actual insurance paid? $1,600. I've paid 10 grand, they've paid 1,600. Now, of course, you could argue the value is in the discount, but they've only paid 1,600. Along with that, I have, with these medical bills that I just paid, I have paid $6,700. So, hopefully this isn't upside down. This year, I will pay $19,200 just to have insurance. Along with having insurance, halfway through this year, I've already spent $6,700. So, I don't really know where to go with this other than just to complain and say that we probably need something better. My family is fortunate enough that we are able to pay that and still live comfortably, still be able to afford food and rent and daycare. I know there are millions of Americans out there, and I know for a fact because the number one reason people file bankruptcy in the United States is healthcare bills. You can look it up. Number one cause of bankruptcy that ruin people's financial lives. It's healthcare bills. Why can't we? All these things I've been complaining about, I feel like I'm complaining about, and I wish I had a solution to. Which I tried to make this video more beneficial to someone watching, which is tip 1, look up this table. You likely can get a discount from the hospital. Tip number 2, if you get a bill like this, ask them what the heck the $250 is for. And then the last half of this video was just me complaining about paying so much money for, what did we really get this year? We went to the hospital a couple times for my son bonking his head. He's an 18-month-old, he's gonna do that. We're gonna get worried, he's our first kid. My wife got a couple required vaccines because she's going to be a nurse. She needs hepatitis A, hepatitis B vaccine, which by the way, were a couple $100 each vaccine. I don't know why they're so expensive. What else? My son also had low blood sugar once, so we took him to Children's Mercy and got him checked up, which that might have been the majority of it. Try to see what some of these are for without sharing too much personal information. I guess what I'm saying is we would have been billed the $29,000 for the care that we got. And instead of being billed $29,000, we are instead billed $20,000 plus $6,000 is what? Or $19,000 plus $6,000 is $27,000, $25,000, somewhere around there. Why am I spending so much money for such little care? Okay, we're at 12 minutes now. I'll stop ranting. Hopefully you guys found those 2 tips useful, and if you have any maybe tips for me, feel free to leave them below. Thanks for watching.